Step 74, multiple IVF cycles. Some couples need only one IVF cycle to get successful pregnancy. Others need two IVF cycles. Some couples need multiple IVF cycles to have a successful pregnancy. This really comes down how many bottlenecks you have in the production line, and also how many different types of bottlenecks you have in reproduction line. To explain this, I need to take you to IVF baby making factory. Essentially, all starts from with egg and sperm. Egg and sperm merge and they make an embryo. Then that embryo should implant in the uterus to produce a baby. In IVF cycle, we want to be able to create good number and good quality of embryos. That comes down to egg quantity and the quality, and the sperm quantity and quality. Then these high-grade embryos need a almost optimal environment in the uterus, and uterus should not have a significant chronic inflammation or structural abnormalities, so that you have a high chance of success in IVF. So if you have some problems in this production line, you may have a reduced chance of success. For example, if you have a problem in sperm quality and egg quantity, that means that embryo quantity and quality will not be optimal, maybe an average. So if you don't have any uterine factors, when you transfer those embryos, you have an average chance of success. If you have multiple problems, especially in multiple divisions of reproduction line, then you may have a significant problem and a low chance of success, and you may need to have multiple IVF cycles to overcome those multiple different bottlenecks. For example, if you have a problem with sperm quality, if you have a significant problem with egg quantity and quality, that means that number of embryos you're creating will be lower and quality of the embryos you're creating will be lower. On top of that, if you have a uterine problems like severe adenomyosis, endometriosis, that reduces the chance of success per embryo transfer. That gives you a very low chance of success. So looking at this reproduction line, you need to try and establish where you actually have a problem and try and improve and optimize those parts of reproduction line. So which some of this can be done by patients themselves, and a lot of this can be done using optimization of IVF treatment. Looking in these four big factors, embryos, eggs, sperm and uterus, you can identify where you should focus your efforts in optimization of IVF so that you have a successful and beautiful child.